Nash, or the non-alcoholic steatohepatitis, which is now called MASH, that is metabolic dysfunction associated steatohepatitis. Now, how does this disease present? This disease is generally asymptomatic. Patient doesn't have symptoms, and it is diagnosed in most of the cases if they are being investigated for some other condition. For example, they may have abnormal liver chemistries, or the ultrasound may reflect fatty liver. You see, in addition, clinically you may find the presence of other components of metabolic syndrome in these patients. For example, there is the classical truncal obesity, they may have type 2 diabetes, there may be hypertension, and on investigation you may also find dyslipidemias. Now, how the diagnosis is made is generally on the presence of abnormal liver chemistry. The ALT may be abnormal, AST may be abnormal, the GGT or the gamma GT may be abnormal, the alkaline phosphatase may be abnormal, and the ultrasound may reflect the fatty nature of the liver. The liver biopsy is conducted in some of the patients to define exactly the presence of fatty liver disease and necroinflammation, particularly in patients who are carrying dual pathology. For example, if the patient is carrying a viral hepatitis or Wilson disease, and if there is a confusion, you may also go for a liver biopsy to see if there is presence of this fatty liver disease. And along with this, you may find abnormal hemoglobin A1C in majority of patients. They may be having type 2 diabetes, or they may be abnormal lipid panel. Now, what are the complications of this disease? This can lead to portal hypertension and cirrhosis of the liver, and ultimately there may be development of hepatocellular carcinoma in patients who have advanced decompensated cirrhosis. Now, what are the treatment options available right now? The treatment generally centers around the dietary modification, the lifestyle modification, and controlling the weight to near normal or normal. For example, acquiring a BMI of 25 or even less for Asian populations. Vitamin E and pioglitazone have been used to control the NASH with some success. Now, recently, metabolic surgery and SGLT2 inhibitors have been found promising. And then if the patient develops decompensated liver disease, transplantation is an option. But now recently another drug has been launched, that is resmetirom. This has been approved by the FDA on fast track for the metabolic dysfunction associated steatohepatitis. The preliminary results show that there is 24 to 36% improvement in the NASH, and there is stability in the fibrosis. That is, this is without progression of the fibrosis. And in 24 to 28% of the patient, fibrosis improvement is shown with stable NASH. So this drug may be a useful addition for the treatment of this condition, and let's see what comes in the future for this condition.